Hello everybody, my name is Dr. Emily King and welcome back to another episode of Dr. King Says. Thank you to all of those who watched the previous episode on COVID-19 as it reached 61,000 views. We're so glad that we can keep the community informed and up to date. As veterinarians, we have access to up-to-date information from our governing body, the AVMA, then a national information network, and our state governing body, the IVMA. So today I wanted to discuss some updated news regarding COVID-19 and your pets. According to the Veterinary Information Network, since February, 4 household pets have tested positive for COVID-19, a Pomeranian and a German Shepherd in Hong Kong, a cat in Belgium, and most recently a cat in Hong Kong. All the animals' owners had COVID-19. Although they apparently picked up viral particles shed by their human companions, none of the Hong Kong pets showed signs of illness consistent with COVID-19. I know this may seem unnerving, the fact that our household pets can acquire the virus, but I always feel that fear comes from the unknown. So my objective today is to educate you on coronaviruses so that you may feel more informed in the weeks ahead. So now bear with me a minute, because what I'd like to do is give you information about the virus family so that it may be easier to understand why we are currently where we are and why we are suggesting that domestic animals are not currently at risk for transmitted disease back to owners. So what we do know about coronaviruses is that they are very diverse and there are hundreds of them. They are capable of occupying a variety of animal species, including birds, dogs, cats, pigs, mice, horses, whales, ferrets, and cows. Often the virus does not make their host sick, and most of the coronaviruses cannot go from species to species. But on occasion, when a virus mutates and this mutation helps its ability to survive, it can jump species. Then, if it can replicate at a high enough level, it can cause an outbreak among people or animals. 7 known coronaviruses infect people. 4 of these are regularly found in a particular region and cause what we call a common cold. 3 of the 7 coronaviruses that affect humans have evolved over the past 20 years, and these can make people severely ill, COVID-19 being one of them. All 3 of these are thought to have come from bats. Why bats? Bats have a special adapted immune system that enable them to carry coronaviruses without being sick. What is interesting is that with COVID-19, experts suspect that the virus may have made the jump from bats to humans through an unknown intermediate animal. So you might be asking, why do these 3 coronaviruses have the ability to transmit to people when so many others don't? And how did the virus jump to humans from an intermediate animal? This has to do with the spikes on the surface of the virus that they use to attach to the outside of the host cell. In many viruses, the virus will only recognize receptors that are specific to one animal species. Recently, it has been shown in a study that the COVID-19 virus can bind to a host cell receptor called an ACE2 receptor. This is important because this particular receptor is found in a variety of animals, dogs and cats being a few. When the virus attaches, it then inserts its RNA. Now, what happens from here depends on whether or not the virus can do 2 things. 1, replicate to high enough levels to destroy healthy cells, and then 2, trigger inflammation that can cause unpleasant symptoms. If it cannot replicate efficiently, then the host immune system will clear out the virus before it causes any trouble. Furthermore, this group of annoying viruses mutates all the time. They are RNA viruses, and unlike DNA viruses, they have no proofreading enzyme to fix mistakes when they are replicating. Plus, they have a very large genome, which leads to a large number of mistakes. Dr. Melissa Kennedy, a virologist at the University of Tennessee College of Veterinary Medicine, says these mistakes are what drive their evolution. Dr. Kennedy explains that these mistakes are completely random, but it does give them a selective advantage over their buddies. She also says that at this time, dogs do not seem to be a hospitable host. While they may have the ACE2 receptor, the virus doesn't seem happy enough in the dog's cellular environment to cause symptoms of the disease. But for people, the virus seems very happy with its environment in our wimpy little cells, and they're more willing to allow it to live there. So at this time, it's thought that dogs can catch the virus, but not give it back to humans. Whether they have enough cells that will end up liking the virus is currently under investigation. Now, cats and ferrets are a bit more receptive to coronaviruses. That's why you're seeing news about cats being both positive and clinical for COVID-19. Despite this information, Dr. Scott Weiss, a zoonotic disease expert at Ontario Veterinary College, and Dr. Kennedy, as well as other experts, believe that the likelihood of catching COVID-19 from a pet ferret or cat is still very low. The fact that the virus is being transmitted very effectively from person to person would indicate that animals are playing little role in the grand scheme of things. As of now, other than the Belgian cat, there are no reports of domestic animals getting sick with COVID-19. Now that could change, of course, with more people getting sick and then exposing their pets. So to sum things up, the real threat is the human-to-human transmission as of now. There's no evidence that pets can transmit the virus back to people, and it's more likely that the pets will get it from the person shedding the virus. With that said, research is ongoing, so we're still advocating that you should include pets when practicing your COVID-19 precautions. As always, we'll try our hardest to keep all of you in the loop regarding COVID-19 and your pets. If you enjoyed this episode of Dr. King Says, feel free to hit that like button and subscribe to our YouTube channel where we review pet products, go behind the scenes in our clinic, host a podcast, and so much more. My name is Dr. Emily King, and thank you for watching this episode of Dr. King Says. Stay safe, everyone.